This is a Midwest Minute with Matt, concussion conversations that just make sense. Before we get started, just a quick note. This podcast is for educational and informational purposes only. It is not medical advice and does not replace evaluation or treatment from a qualified healthcare provider. Listening to this podcast does not establish a provider-patient relationship. Every brain injury is unique, and what we discuss may not directly apply to your situation. If you're experiencing symptoms or have concerns, please seek care of a licensed medical professional. If this is an emergency, call 911 or your local emergency services immediately. Welcome to episode 2 of A Midwest Minute with Matt, concussion conversations that just make sense. I am your host, Matt Campbell, and today our second episode is titled, Why Symptoms Keep Changing. One of the most frustrating parts of concussion recovery is not the injury itself, it's that symptoms change and evolve over time. Because symptoms don't have to follow rules. They come and they go, they evolve. Sometimes they're worse than other times. Headaches become dizziness, fatigue becomes anxiety, a good day becomes a confusing setback, and most patients are trying to figure out why. So today we're going to make sense of symptoms, why they happen, why they change, and what they may actually be trying to tell you. One of the first things I try to get people to understand during their own concussion recovery is that symptoms are going to evolve throughout your injury recovery. Sometimes they're going to be worse than others, but for the most part, symptoms are communication. They're not chaos. They're feedback. It's the brain telling you what it likes and what it doesn't like, telling you where your limitations sit, and it's helping us modify our day-to-day routines to ensure that we're not increasing symptoms overall or changing the injury severity in and of itself. They come and go, and their origination happens from multiple systems. If we think about symptoms as feedback, it can help us figure out which system is not working the way we want it to. Just because somebody has an increase in symptoms or a change in their symptom severity or change in symptom presentation does not mean that they are setting themselves up for failure. It doesn't mean that it's a setback necessarily. We can learn from the symptom changes, we can change what our structure looks like, and we can continue to evolve. But what symptoms should I be looking for? We need to make sure that we're identifying what symptoms are traditionally what we're talking about. So some of your more common symptoms that people will notice: headaches, fatigue, dizziness, light sensitivity, noise sensitivity, changes in sleep habits, irritability, and then the one that's challenging to understand for people is brain fog. When I sit down and meet with people for the very first time, I ask them to try to describe how they feel. And for most people, it's, I don't know, I just feel off. I don't feel good. Something doesn't feel right. I just feel weird. And when we try to put an idea on what weird feels like, generally they are referring to brain fog. They just feel like they're not themselves. They feel slower, they feel hazy, they feel like they're running down or running behind. They feel like they can't keep up with the environment that's around them. I give the analogy when it comes to brain fog as when you're in a 90s or an early 2000s movie where the main character is walking slowly through the hallways of school and everything else is hazy and everybody's moving in fast motion, but the main character's moving in slow motion. That's one of the best ways to describe what it feels like for some people as they move through that brain fog. Some other uncommon symptoms that people may not even realize before they've actually talked or gone through an evaluation is confusion when you're in busy environments. Oftentimes, patients will describe the grocery store as a place that's very hard for them. They get overwhelmed. They feel a significant increase in dizziness, nausea, light sensitivity, confusion, disorientation, and it happens because of the combination of all of the status changes inside of the grocery store. Bright lights, shelves all look the same, loud noises, a bunch of movement, a bunch of background images, a bunch of different things. So uncomfortable with busy environments, difficulty with conversations, carrying on conversations one-on-one or in a large group setting, feeling dizzy or nauseous or weird after a car ride, anxiety increasing out of nowhere, especially if you've never had anxiety before. Anxiety can be scary and hard to describe to somebody else from your concussion symptom set. A lot of patients will sit down and say, I don't know what's wrong, but I just feel off. I feel like I'm not myself. I feel like I'm going through the motions. I feel like instead of being able to make decisions or make things happen, I'm just along for the ride outside of my own body. Some people will describe it as, I feel like I'm sitting like 6 inches behind me, just watching what's happening to me and trying to figure out how to feel. Not all symptoms are easy to understand. and they're very difficult to explain them to somebody else. And that's one of the challenges when it comes to people isolating after a concussion. They won't be able to explain how they feel, or they get tired of saying the same things over and over again, so they stop telling people how they truly feel. But why do symptoms change overall? It's one of the hardest questions and hardest things to answer for people, especially on that first interaction. Symptoms can change for a wide variety of reasons. The easiest one to explain is that we've had an increase in demand. What that means is there's been something that we've added throughout our day that's changed how many different systems have to work, how many different systems have to work at different speeds, or how the different systems are communicating with themselves. So when we talk about the primary relationship on increase in symptoms, it tends to be a change in demand of your day-to-day routine. Most people won't think about how complex moving through life really is until they can't move through life very easily, or they get very symptomatic while they're trying to do it. When we talk about increase in symptoms or increase in symptom load, they can a lot of times be tied back to low sleep quality or sleep quantity. Sleep is the number one performance enhancing drug in the world. We want to be better people, funnier, smarter, better looking, more athletic. Sleep. The problem is after a brain injury, we don't get good quality or good quantity of sleep. That leads to an increased amount of stress, which can lead to an increase in symptoms. The last major change and cause for fluctuation with symptoms tends to be increases in your environmental stimulus. Again, we're going back to increase stress and increase load. The more that's going on, the more the brain has to process, the harder it is for the brain to handle. Most of us are used to doing multiple things at the same time. Carrying on conversations while answering a text message and watching TV. Going for a run on the park while listening to my headphones and talking to my wife. These are things that it's difficult for people to understand that after a brain injury, we don't have the capacity to do multiple things at the same time like we used to before we got hurt. This will often lead to fluctuation in symptom severity and symptom type. I talk about the brain's protection mechanism for itself. Generally speaking, symptoms are the brain's protection mechanism. Right now, when somebody is dealing with a concussion, the baseline protection mechanism that the brain has is it gives you a headache. It doesn't like something that you're doing, so we have to figure out what the brain doesn't like. Early on during concussion recovery, it's being awake. The brain wants you to go to sleep because that's how the brain heals. That's where most of those neuron reconnection comes in. That's where hormone regulation comes in. That's what the brain wants in the early stages. It wants you to go to sleep. When you're awake, you get symptomatic. As you're going through your concussion recovery, symptoms will fluctuate. That first line of defense is a headache. If you don't listen to what's going on, and the brain will make you dizzy. If you don't listen to what's going on, the brain's going to make you nauseous. If you don't listen to what it doesn't like, it's eventually going to make you throw up. And at the end of the day, if you don't listen, the brain will eventually make you pass out. Now, it takes a lot to get you to that point, but if we think about the symptoms as the brain's protection mechanism telling you, hey, I don't like something, I don't want you to be doing this, and as those symptoms flare up, it's the brain adding another layer of protection to itself, another layer of protection, another layer of protection, until ultimately it can force you to stop doing what you're doing. One of the hardest parts of brain injury recovery is finding out what the brain doesn't like. I tell patients all the time, if I gave you 10 things to do for the next 10 days, you're going to feel 10 different ways afterwards. And it's because what the brain can handle energy-wise at the time that we're doing them. That's why symptom fluctuation is so difficult for people to understand. I did the exact same thing I did yesterday, and I feel like I'm going to throw up everywhere and I can't see straight. But yesterday I did it just fine. It's frustrating, but it is very normal for people to undergo during their concussion recovery. Your symptoms are not proof that anything's broken or that you're failing in your concussion recovery. They're clues, they're patterns, they're feedback to tell us what's causing the problems and what we need to adjust. And when they're understood correctly, they can help guide your concussion recovery forward. If this episode helped make sense of your symptoms, share it with somebody who needs it. Follow along at MW Concussion on all social media platforms. Check out the website at mwconcussion.com and tune in next Thursday for episode 3 of A Midwest Minute with Matt. Concussion conversations that just make sense.